Today, the High Court ruled that government policies on discharging untested patients from hospitals to care homes in England at the start of the pandemic were unlawful. Patients were rapidly discharged into care homes without testing, despite the risk of asymptomatic transmission. Government documents show there was no requirement for dealing with this until mid-April.
The ruling says the decisions of the Health Secretary to make and maintain policies and documents issued in mid-March and early April 2020 were unlawful because they failed to take into account the risk to elderly and vulnerable residents from non-symptomatic transmission, which had been highlighted by, among others, Sir Patrick Vallance in a radio interview as early as the 13th of March.
Despite assurances like this from the then Health Secretary Matt Hancock.
Right from the start, it's been clear that this horrible virus affects older people most. So right from the start, we've tried to throw a protective ring around our care homes.
And this.
Is it true hospitals sent patients with coronavirus back to care homes in England?
Well, we've put in place testing to ensure that hospitals send back when people leave hospitals, they are tested, and then if they are going to a care home, they're isolated until they get the results of the test.
A policy to test care home patients before discharging them from hospital was not introduced until mid-April 2020.
Today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home.
By that time, a staggering 25,000 people had already been discharged from a hospital into care homes without being tested for coronavirus.
More than 20,000 elderly or disabled care home residents died from COVID between March and June 2020 in England.
This was the response from the then Health Secretary Matt Hancock to the court ruling.
We ministers were not told about the asymptomatic transmission. This is a really important scientific fact.
In fact, SAGE had said asymptomatic transmission cannot be ruled out in early February 2020. And this is what Professor Chris Whitty, the Chief Medical Officer for England, told the Health and Social Care Committee on March 5th of that year.
There is a large iceberg of people who've got asymptomatic infection, so a very large number of people have been infected in Hubei without being detected. The reason we don't detect them is we do not currently have a test which can say, a serological test, which can say this person has been infected even though they never had symptoms.
And here is the government's chief scientific advisor, Patrick Vallance, speaking to BBC Radio 4 on March 13th.
It looks quite likely that there is some degree of asymptomatic transmission. There's definitely quite a lot of transmission very early in the disease when there are very mild symptoms.
Then Prime Minister Boris Johnson acknowledged in a press conference on 18th of March the problems the virus posed.
The thing about this disease, it's an invisible enemy, and we don't know who's transmitting it.
So Johnson clearly knew at that time that people without obvious symptoms might be amongst those transmitting the virus. He directly commented on papers examining the issue at a COVID press conference on March 25th.
Just Patrick, on the numbers of people who have the disease asymptomatically, there was a study I saw quoted from some Oxford academics saying that as many as 50% may have had it asymptomatically, or I think a lot of people will have seen that story. How do you evaluate that at this stage?
We simply don't know at the moment, and that's why the antibody test is so important. So there are estimates that up to 80% or more of people in Wuhan weren't detected. There are estimates that of those who are positive, so that's a small percentage of the population who were tested positive, quite a number of them were asymptomatic in a town in Italy.
Asymptomatic infection.
Asymptomatic transmission.
Asymptomatically.
Despite this, a policy to test care home patients before discharging them from a hospital was not introduced until weeks later in mid-April 2020. This was the response from then Prime Minister Boris Johnson after being told government policies on discharging untested patients from hospital to care homes in England at the start of the pandemic had been ruled unlawful by the High Court.
The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
The media wasn't falling for it.
The Prime Minister at Prime Minister's Questions last week echoed the comments of Matt Hancock when he said that the government did not know about asymptomatic transmission of COVID-19 before people were moved out of care homes, moved out of the health service and into care homes. That is demonstrably not the case. I'm just wondering on what basis the Prime Minister made that claim on Wednesday, because quite frankly, he either misled the House or was indulging in a barefaced lie.